This lecture is being brought to you in part by the generous gifts of these sponsors.
All right. Does everybody hear me okay? Yep. I'm Dr. Johnathan Edwards. Thanks for quite an introduction. Didn't expect all that. So my name's Johnathan Edwards. Not the preacher Johnathan Edwards in the sinners of the hands of an angry God that I had to read in front of my 9th grade class and still have trauma to this day because of it. But here I am. So, all right. Topic tonight. So, ketamine. That's a drug that a lot of people probably haven't heard of or maybe have heard of in different aspects. Get my clicker here. It's an anesthetic to healer. How's that? Let's get right into it. How can something be an anesthetic and a healer? How can something that numbs your pain at the same time take you to a cure? Or, what's the difference? Is it both? Is it safe? Could it be right for you or your loved one? Tonight's going to be a lot about suicide. Everybody in this room has a story about suicide, I guarantee it. And how ketamine, most people don't know, can stop suicide in its tracks. I have a story. Every suicide ends in one life, but it rolls the grenade into the lives of many others. I experienced this firsthand when I was just 7 years old. My grandfather sat on his couch and he placed that shotgun to his chest, pulled the trigger. Shortly after, my parents took me to the house, and I remember the couch. I remember looking in the other room, seeing my parents, aunts, and uncles, my grandmother crying and wailing like I'd never seen before. And I was just a 7-year-old trying to make sense of it all. And I've thought about that day ever since. Suicide, it's a captivating word, powerful word. It's a hard one. But did you know that a person dies by suicide every 10 minutes just here in the US? But nobody talks about it unless you bring it up, and then everybody has a story. Mental health crisis has always been with us, and of course the pandemic just made it worse, but it's always been there. But there is good news. We can all do something, and sometimes it's just as simple as starting the conversation. Depression and loneliness, that's the leading causes of suicide. In the US, over 9 million women and children will be diagnosed with some form of depression. Anybody who's been depressed knows what that's like. It's kind of like that foggy picture there, walking in lead boots. You don't know your direction. You're not aiming right. From that 9 million, 1 million will go on to attempt some kind of what we call suicide, which we'll get into. And since the year 2020, nearly 50,000 people have taken their lives by suicide. That's the most ever since World War II. What is suicide? Well, the ingredients for suicide, it's severe loss of hope, so hopelessness. You're a burden to your family or society. You have a severe isolation in a moment of extreme vulnerability with an access to lethal means. Those are the ingredients, and we'll get back to that. Usually there's social, economics involved, access to care. But the thing is 50% of people will never tell you that they're going to take their life. No clue, not one. And then we'll get into that too. Growing suicide statistics in the United States. It's now the second leading cause of death in children 10 to 14. How did we get there? In young adults 25 to 34. Globally, it's the fourth leading cause of death. In the US, it's about the 11th now. And Did you know 40 veterans, not 20, 40, die every day from suicide? That usually, most people thought it was 20, but the latest is 40. So. Yet the media rarely talks about suicides. Why? I mean, isn't 50,000 people a big enough number to raise some level of concern? I mean, you would think, but it's not. It's like a fully loaded airplane crashing into the earth like a lawn dart every single day. But it doesn't stop there. We have 100,000 overdose deaths every year since the year 2020. Again, how did we get there? So, how many deaths, how many of those could have been suicides? So you heard it a little bit about my history, my transformation. And again, I'm an anesthesiologist, not a psychiatrist. How did I get into all this? Well, obviously some of my background tells you my interest and motivation in this field. And I've come across some fortunate people. So during medical school, of course, I was always intrigued by suicide and mental health. And I always wondered, like, why isn't there anything we can do about this? I'd be on my psych wards and just seeing people take their life by suicide and like just remembering there was nothing we could do about it. So with difficult questions, usually how you find them, what you need most, you have to look in the places you least want to look. It's an old Latin saying that I'm not going to try to pronounce. But some of you may recognize that. So in my medical career, I've been lucky enough to work with people like Gavin de Becker. So Gavin de Becker is an interesting fellow. He owns Gavin de Becker and Associates. So if you know like who does the Secret Service or the private security for people like Robert F. Kennedy, Elon Musk, Jeff Bezos, and many others in that genre, that's his company. That's what he does. He wrote a book. I'll try to use the pointer here. I'm not good at it. The Gift of Fear. So this book is about kind of your intuition and what you should be really scared of or not, you know. So his book, he's been on Oprah many times, and it's a world bestseller. So one day, well, I'll get back. Gavin has something in common. He also lost his mother to suicide at 16. And so one day Gavin asked me, he said, "Johnathan, how do you feel about the drug ketamine?" And I was like, that's kind of a softball question. I'm a board certified anesthesiologist. And I'm just like, I wonder what he's getting at. And it's like, so yeah, it's an anesthetic and I use it in kids all the time. It's been used since the 1960s or late 60s and 70s. It's on the WHO list of essential medications because it's so safe. But then I said, it was repurposed and it could be used to treat depression, anxiety, PTSD, and it could stop suicide. And Gavin has a way of answering, and he said, "Johnathan, I'm glad you answered that way. But I just want to tell you right now, if you answered the other way, I was prepared." And I was like, he came at me just like that. And I was like, wow. And so this is what this is kind of about. Why was Gavin prepared for a debate had I answered the other way? Ketamine is the most important breakthrough in mental health in 50 years. I didn't say that. That's from Thomas Insel, MD. He's the former director of the National Institutes of Mental Health. He's kind of like what Fauci was for the NIH, except for in the mental health space. Many believe, and I just got these comments tonight, that ketamine is nothing more than a horse tranquilizer or a party drug. It used to be called Special K, and everybody has probably heard those stories. Many healthcare providers are completely unaware that it can be used to treat depression and suicidal ideations. Being an anesthesiologist, I can tell you, it's been used safely. I mean, it's crazy how safe it is, in children especially. and I've used it for almost 25 years. Gavin and I agreed that after our discussion that a book needed to be written, and you don't get this offer every day from a best-selling author. He said, if you write the book, I'll help you with it and do the forward. And so that's how this book right here, The Revolutionary Ketamine, came to connaissance, or came to life. What makes it revolutionary? Well, the discovery of ketamine as a rapid-acting antidepressant changed neuropsychiatric therapeutics forever. Instead of waiting weeks for an effect, you can get an effect from ketamine in hours. Research has shown that even a single administration of ketamine in a person who has suicidal ideations can stop it within that hour. Not all of them, but that's just some of these studies are very clear on that. And one thing that has to be highlighted is that when ketamine is paired with psychotherapy, it's staggeringly effective. By itself, it's not as effective. It has to be paired with therapy. And so when patients come to me, and they say, oh, I just want the ketamine. No, that's not the way to think about it. You need a therapist. So these kinds of results were unheard of until now. One of my favorite studies is from Dr. Lori Calabrese. She's a psychiatrist. 2019, she studied 231 individuals with suicidal ideations and other depression and such, and she gave them ketamine and proper therapy. She found that nearly 8 out of 10 of those people no longer had suicidal ideations. I mean, and there were no suicide attempts. And this is a real world outpatient setting. Not many studies like that. Most studies are done like in Yale or things like that, and in those kind of clinics. No, this is a private psychiatry clinic. And she showed those kind of things. Dr. Calabrese says that ketamine is fertilizer for the brain in her colorful way. I've met her, and she's a very nice person. So that means it changes the neuroplasticity of the brain after you take it. And that's part of where the magic happens. And, this happens with all antidepressants to some extent, and we'll get into why that is. Her latest research involves combining the ketogenic diet, which some of you may have heard of, along with ketamine and therapy. And that's all in the news today. So how does it work? Well, ketamine, technically from a scientific, it blocks what's called NMDA receptors. And what does this do? It increases glutamate. What does glutamate do? Glutamate is that neurotransmitter in the brain that is the reason you can ride a bike after years of never riding a bike. It gives you that long-term cognitive memory. It also promotes the growth of new neural connections. Again, this neuroplasticity in the areas of the brain responsible for mood regulation and cognition. But there's another part to this story besides the biochemical part or the science part. Ketamine works because it treats more than the biological problem. It treats the root cause of depression. Mental health is more than just the absence of mental disabilities and disorders. The ketamine experience involves the mind, the body, and the spirit. It dissolves the ego and taps into the human psyche. Carl Jung once said that the psychotherapeutic endeavor is the pathway of truth. And ketamine paired with psychotherapy allows patients to complex emotions and truths, works towards inner healing. And what does it do? It changes one of those ingredients of suicide. It changes the hope equation. That's how I like to explain it. Remember, hope, burden, isolation, vulnerability, a very vulnerable moment with a lethal means. Those are the ingredients for suicide. Why isn't ketamine a standard pharmaceutical, you might ask? Well, pharmaceutical companies would love just to pack ketamine into a pill and call it good and sell it and make millions of dollars. But I can tell you this isn't likely. You can't, in all my years of working in this field, you cannot pack a biological, a psychological, a spiritual experience into a pill. It takes more than that. It's a journey. It's not just about giving the medication. There's much more to it. It's also out of patent, so not much impetus for pharmaceutical companies to get into it. It's off-label for mental disorders. So, what does that mean? It means it doesn't have a clear indication from the FDA. It does for anesthesia, but not for mental disorders. But realize that 80% of all medications out there are off-label, used off-label, I should say. Spravato recently has come onto the scene. That's called S-ketamine, and it has been FDA approved. And that is an intranasal spray, and you have to have insurance authorization, and you have to go to the clinic to use it. Safety concerns. Maybe some of you have heard or read about Matthew Perry and his recent unfortunate death, and it's a very sad one. Perry had used ketamine for years. I mean, we're talking 5 or 6 years, and he used it properly in clinics actually before he, got whatever happened to him. But I can tell you there's more to the story. He had, he was a heart attack waiting to happen. There were other drugs involved. And if you ever want to read more about it, I kind of go into it on my Substack. And it's a sad, why is it so sad? Because he was a big addiction advocate because he'd suffered with it for so many years, and he put millions of dollars into a foundation that, who knows where that's going now. But he was a special person in that, and it's a sad story all around. The stigma of it being a party drug. Everybody's like, that's just for, people on the street. And then but let's get into that a little bit. Street ketamine has nothing to do with the ketamine you get in a clinic. Street ketamine is just that. It's made on the street. It's impure. It's usually laced with fentanyl or other such, poisons. And the people who abuse ketamine on the street use it in grams, like 2 to 3 grams at a time, multiple times a day. A dose of ketamine in a clinic is 1/10 of that dose. It's in a sterile vial. It comes out of a pharmaceutical compounding pharmacy and given in the right situation with the right professional in the right situation. And it's a therapeutic experience. And that's one of the biggest problems I have telling people they're just not the same thing, and to think about them in 2 different camps. Some say there's research gaps. There's plenty of research on it. Not enough mental health providers are advocating its use. And again, pharma companies don't like to invest into research that, they know they can't make a huge profit on. Is ketamine safe? That's a resounding yes. There's been over 70,000 papers that you can look up on PubMed that have involved ketamine, all showing that it's a safe drug when given properly. So, of course, it should always be given by a professional. It does mildly increase heart rate and blood pressure. It can cause nausea and vomiting, though rarely. Has a potential for abuse, like we've learned with Matthew Perry and others. It does cause some hallucinations, dissociations, and it can cause out-of-body experiences depending on how it's given. Usually that's a bit too much. It's not meant to do that. And there are some bladder issues with the long-term misuse of street ketamine, which we've already defined. It's called ketamine bladder, but that has never, ever been shown to occur with pharmaceutical-grade ketamine. And if anybody has a study on that, I'd love to see it. And again, the potential for addiction happens with any drug. You know, what's it used for? Well, as I said, it's primarily an anesthetic. In the mental health space, of course, it treats depression. But now we have to ask, what kind of depression does it treat? Run-of-the-mill depression usually is just self-limiting and goes away, and those psychologists and psychiatrists here know that very well. Treatment-resistant depression, TRD, that's the nasty one. That's the one to watch out for. That's the one where you've tried 2 medications in over 4 to 8 weeks and nothing happens. You're in the same place as where you started. That's the one that most often leads to suicide. And ketamine has been shown to have very good results in treatment-resistant depression, along with, again, psychotherapy. Pain management. Well, ketamine is great for like complex regional pain syndrome. Some of you may have heard, like, that kind of pain that just fibromyalgia, like it's insidious. It's the hardest stuff to treat ever in the pain management spectrum. Well, guess what ketamine does? It can help in the treatment. It's not the treatment, it can help in the treatment. And what does it do? Decreases opioid use. Great. One less thing contributing to the opioid crisis that we're all facing today. It's usually given, it also treats anxiety, PTSD. It's usually given intravenously over a slow drip. Can be given intramuscularly, intranasally. It can be given orally, usually in a troche. I've seen it given subcutaneously. And there's even dermal applications I've seen on the Google patents kind of thing, but that's the most common way. So here's a couple of heavy subjects, and then I promise it'll lighten up. Children and suicide. Anybody who studied this knows that children experience suicide much differently than adults. 50 years ago, it was extremely rare to ever hear of a child taking their own life. I mean, in the 1950s, that curve was flat. Today, that's not the case. According to the National Institutes of Mental Health, 4 million children will be diagnosed with some kind of depression. Lockdowns also had much to do with this, of what we're seeing today. And just to give you an idea, I'll show you in one of my first books I wrote, the consequences of lockdowns are something that former CDC director Dr. Robert Redfield correctly highlighted, that 7 million children receive mental health services from school. What do you think happens when they were forced to stay home? So in Las Vegas, my former city, there was 18 school-age children who took their life in the year of 2020. Again, partly from the lockdowns, but it's important to highlight, these were not kids with severe psychiatric illnesses. These were kids who got very depressed and lost hope. That's what happened. So what's going on there? Well, part of it's social media. It's this generation's cigarettes. It hooks them and hooks them young. It's kind of like Las Vegas slot machines. They know who you are and they know how you play. Social media does it today with likes, comments, and shares. So if you ever want to research that, it's called variable reinforcement. And what adolescents are 7 to 8 hours on that smartphone nowadays. Some of us can't say we do any different, but and awareness is hopefully going to be corrective in itself. And if you want to get more into this, Johnathan Haidt, he wrote The Anxious Generation. He's written so much on this topic and say he's an authority on it. Veterans and suicide. Combat's no longer the leading cause of death in veterans. What is suicide? When soldiers go to war, they don't really know themselves. And then they get on the battlefield and they do horrible things that they never thought they were capable of. And then they come back. And that's what the PTSD ensues, and that's when they fall apart. And then people say like, just get rid of the PTSD. You can do it. Go back to work. Get into society. Wrong. That's not the way to think about it. The PTSD won't let go of them. That's the way to think about it. And anybody here who's a veteran, I think, can get that. We lose about 40 service members a day. We used to think it was 20. Of course, it's younger veterans. And of course, it's usually male. And it's usually those, just think about it, veterans are well-trained and most of them have guns. So governments don't hesitate to send their soldiers to war, but they hate paying for their mental illness when they come back. Every president since Nixon has rolled out a plan to decrease suicides. And I'm not making any judgments, but I think we need to ask where we are with that. Vietnam War. The FDA fast-tracked ketamine's approval in 1970 for anesthetic use. It was called a battle buddy drug. Why? Because ketamine's so safe. It does not decrease your respirations. It does not decrease your blood pressure. It allows you to dissociate, decrease the pain, and allows the soldier to get their wounded colleague back to safety in a wartime situation. I mean, you compare that to, say, giving morphine, it's not the same. Most people you give morphine, I mean, unless you're a well-trained professional, it's pretty easy to overdose people on that drug. They just stop breathing and die. Ketamine's, that's not the case. So that's why it's still the most utilized anesthetic. And I was actually going to bring up the latest STEM talk with Dr. Ken Ford and Don Carnegas. They talked with a trauma doctor named Dr. Butler, and he highlighted the use of ketamine in the battlefield even today. So if you want to find out more about that. Here's another difficult topic and something near and dear to us all: first responders and suicide. Does anybody in here think that more police officers and firefighters die from suicide than in the line of duty? That one really hit me hard when I first learned it. 2024, the IHMC, we had a blue sky event. Some of those fire chiefs and firefighters are here in this audience. And we brainstormed about the astronomical figure of Florida firefighter suicides. One station lost 4 firefighters in 1 year. And I just learned that we've lost 2 more in the last 48 hours here in Florida. And think about that. Think about who we're losing. These people they're the people who are going to come in a smoke-filled house and carry you out. We need these people. We can't afford to lose them to suicide. That's why this is important. So PTSD is, of course, one of the major causes. And just remember that PTSD, it's a rut that you can't get out of no matter how hard you try. In psychiatric medicine, we call that the default mode network. So it's we can go more into that, but other drugs like MDMA have shown promise in PTSD. Stage 3 at Johns Hopkins trial, but the FDA shot it down despite pretty good evidence. Reasons weren't very clear. Anyway, the point is that ketamine is the one drug that's legal, safe, we have available today, can be given in a clinic, paired with psychotherapy, that is effective for treating PTSD. If you remember anything about that, that's one thing I'd hope you'd leave with. Okay, take a breath. All right, now, here's some good news. Here's some stories. This is my favorite part, is like telling about the individuals whose lives were transformed, and I hope this will help you appreciate. So, as early as in 2012, there was a businessman named Dennis Hartman, and he says, I look at the cost of not using ketamine. For me, it was certain death. So Dennis was one of those individuals who suffered from treatment-resistant depression, that bad kind of depression all of his life. He had a suicide date picked out before he went to a National Institute's trial of ketamine. The depression lifted, and he's living. He even went on, he was so impressed with it, he went on to found the Ketamine Advocacy Network, which is still going on. Something near and dear to me, I have a patient. You guys may remember the Mandalay Bay massacre, worst events next to Sandy Hook, probably. October 1st, 2017, Mandalay Bay, Las Vegas, Nevada. Country music singer Jason Aldean was on stage. Why do I remember that? Because I remember being in Las Vegas and we were inundated with surgeries for weeks because of it. 58 people were tragically killed, over 850 injuries. Dan, we'll call him my patient. He was a first responder on the scene, and he still suffers from PTSD. He can't unsee what he saw. And despite psychotherapy, antidepressants, and other modalities, he still has the PTSD. And ketamine for him is one of the only things that helps. And he receives it monthly and as needed, but otherwise he might not be here. Iraq War veteran Mike Donnelly, so some of the veterans in here, I wanted to put that. So he presented with suicidal ideations, PTSD, to the VA. And anybody knows how the VA works, the physician assistant said, here's a card, go dial the number. Gave him a pat on the back, said, you'll be fine. I mean, what did I say? 40 service members are taking their lives every day. This isn't something you say to a veteran who's at the end of his rope, losing his family, planning his own suicide. I mean, he had all the classic signs of suicidality. He read about what ketamine could do for him, yet he couldn't afford it, and insurance wouldn't pay for it. They only pay for the Spravato. They will not pay for an intravenous administration of ketamine, even though it costs dollars to do so. I mean, besides the fact it's in a clinic. So he sold his prized guns. He helped pay for the treatments. And once he got it, the depression lifted. PTSD improved. He got his life back and he got his family back. I had a 17-year-old present, just a young man, wanted to kill himself and suffered from severe social anxiety and depression. So I gave him a course of ketamine treatments. After the first one, the suicidal ideations decreased. After 2, he could see that things were changing and for the better, and he was opening up. And after the 3rd, he could start seeing that he had a future and that he wanted to move on and start improving his life. And through an act of his own will, he could take himself away from those dark places that led him to want to kill himself. He even stopped his antidepressant medication. He has a job now and he's doing well. One of my favorites is Olive's story. Not my case, but she was at a Florida clinic, and so she's a young girl with a lifelong history of bipolar disorder, abuse, PTSD, multiple suicide attempts. At 26 years old, she said, enough is enough. She booked a plane to the Netherlands and signed up for a compassionate euthanasia. So that's a big word nowadays with Canada, the MAID program. There are about 15,000 people a year dying by euthanasia there. So, and let's make another point. Suicidal individuals desperately want to live. They just see no other way around their pain. So the day she was to leave, at the behest of a friend, she checked into a clinic and she got ketamine 3 times that week. Again, it's a story you read about, but she never took that flight. I had a patient with prostate cancer. He presented with suicidal ideations, 53-year-old male. He was put on the testosterone blocker medicine called Lupron. And his ideations started shortly after that, and they were 9 out of 10. He came to me and he said, I'm not going to a hospital. I don't want to go to a hospital. I tried to get him to go to the hospital because that's, the right and safe place for him to be. And he never had a history of suicidal ideations before this. And said I would take my life now, given the right situation. So I gave him ketamine. Again, his suicidal ideations gone. And from there, he got psychotherapy. He saw a Reiki healer, and he even tried cannabis. He went on. He stopped the Lupron. He got all of his radiation treatments. And then he even did a treatment at the end of it all after, I think, 3 months or something like that. And he had an enlightening experience and doing well. Here's an interesting, I had an elderly patient come in for ketamine, and he had a history of child abuse. And it touched me when he told me that for the first time ever, he saw himself through his parents' eyes, thinking about that abuse he endured as a kid. He said that he wasn't a bad person, shouldn't be ashamed. He spoke of words of acceptance, perhaps a sense of being enough, and that a lot of people say this, everything's going to be okay. That's just what a lot of people after the experience will say once they're come out of it. Okay, so to kind of finish up, ketamine's unusual history. Again, it was synthesized in 1962 by Dr. Calvin Stevens. Why? Because there was a drug called phencyclidine that we used to use, and it was causing so much postoperative delirium that the anesthesiologist at the time said, hey, this is a great drug for what it is, but we need something a little less potent. So that's where the idea of ketamine came in. And, it's gone there. And let's recall that phencyclidine is related to PCP, angel dust. So anyway, it was, as I told you, it was fast-tracked in 1970 for anesthetic use in the Vietnam War. It quickly became the most utilized anesthetic worldwide. And why? Again, it can be used with no extraneous oxygen or hemodynamic monitoring. Of course, if you have those things, you should use them. But I've practiced in Senegal. I've practiced in France. I've practiced in Peru. I've practiced in South America, other countries. And let me tell you, when you see those healthcare systems work, we take a lot for granted in our Western civilization. We have electricity, we have oxygen, we have proper medications, clean equipment. I can tell you some stories. Not everywhere is so well equipped. So that's why ketamine can be used, in the jungles. It can be used in the places where there aren't doctors or things like that. And so that's what I'm getting at. It's still on the WHO list of essential medications. What does that mean? So any medication that meets the needs of a basic healthcare system, again, that's what exists in much of the world. Most people are amazed to learn that ketamine actually had plant-based origins. It has a connection to nature. So the Peruvian torch cactus, it has precursors called hydroxynorketamine. The other one is the bark of acacia trees. Maybe some of you guys have a couple of acacia trees in your backyard. Anyway, it contains alkaloids, one of which is ketamine. So it's just, the point is that ketamine has its pharmaceutical inspiration comes through nature, even though all ketamine today, at least used in a clinic, is made sterilely in a compounding pharmacy and then prepared. I get this question a lot. Is ketamine a psychedelic? I argue that it is, despite what the research says. The research says ketamine and things like MDMA are psychedelic-like compounds. So let's get into that. Well, the definition of a psychedelic is one that touches what's called the 5-HT2A receptors, these serotonergic or serotonin receptors. And of course, the primary mechanism of ketamine is in NMDA receptor blockade with an increase in glutamate, but that actually modulates these receptors, these serotonin receptors, leading to neuroplastic changes. And more than that, it produces everything about a psychedelic experience. It transcends physical reality, produces a mystical experience. Ego dissolution, loss of time, oceanic feeling, integration, and hallucinations. Those are the main elements of any psychedelic experience. Again, it's a biological, psychological, spiritual experience that cannot be put into a pill. And then I'll direct you to this, kind of says it, this hand transcending the fabric of reality. So I know my daughter's going to be very embarrassed, but she drew that and I adore it. All right. One of my first books was called Suicide, COVID-19, and Ketamine. This is the first book on when I wrote about the lockdowns and some of these things we were seeing and the consequences that we've already discussed. I have a neat story about it, though. I was speaking one day with the new NIH director, Dr. Jay Bhattacharya, and we were talking about the subject, about how the lockdowns and ketamine and all this, and then I said my name. I said, I'm Johnathan Edwards, and he stopped and he goes, "Oh, you're Johnathan Edwards?" And I said, "Well, I know who you are, but I'm surprised as hell you know who I am." Anyway, so I thought that was neat. He'd already read my book, and he said, well, I was one of the only ones writing about these kind of things during like 2020. And so anyway, that was, and we still keep in touch today through what's called the Broken Science Initiative, which we're both a part of. And so that book led to, again, the revolutionary ketamine. Skyhorse Publishing, which is a subsidiary of Simon & Schuster, asked me to publish it or write a second edition, and that's how that came to life. Again, it focuses on veterans, first responders, adolescents, and athletes, which I'll get into. Audiobook just came out. Check it out. One of my highlights of the revolutionary ketamine was I gave the book personally to Jordan Peterson. He has an interesting story. He's a Canadian psychologist, for those you may have not heard of. He had a hard time with ketamine. He was addicted to benzodiazepines, and he had this other chronic pain syndrome that he almost died from. Anyway, he didn't like the experience at all. His direct quote was that I felt like I was in hell for 2 days during my ketamine treatments. I mean, it was, so he wasn't a fan. And so I didn't know what was going to happen when I presented. So anyway, I got the opportunity to talk to him about it. And we had pretty much a one-on-one discussion in a small crowd. And at the end of it, he agreed that he thought ketamine had enormous potential when paired with psychotherapy. So I thought that was quite something coming from somebody like that. I've worked with many athletes, as Lori read in my bio. I was a former aspiring professional motocross athlete. So one reason for that is because I get it. I understand what's going through your mind when you're young and trying to just go for it at all costs, trying to rehab yourself from all your injuries and, dial in your nutrition and all that, and race bicycles and all that kind of stuff. And so I've had a great career and adventure through athletics. I work with many UFC fighters, motocross racers, cycling, some tennis. But the main thing here, when I work with these athletes who hit their head constantly, and I'm no exception, I've hit my head many times in my life. there's a thing called CTE, or chronic traumatic encephalopathy, and it's real. And some people who get it actually go on and take their life because of it. And I've had 2 athletes do that who were very close to me. So it's a subject near and dear. So I like to raise the awareness of CTE and the risk of suicide and the possibility of utilizing ketamine for mental health. Here's Darren Waller. He's a tight end, or was a tight end of the NFL. He's a big fan of using ketamine, and he has his own addiction story that's very powerful. It's in the book. Misha Tate here. Sorry, I'm not good with this laser pointer. I've been helping her since 2015 when she beat Holly Holmes for the title. And then here over is Francis Ngannou. He's a well-known MMA and now boxer from Cameroon, and we speak French together, and I help him in various ways. But we got to talk about, hey, if you hit your head too many times, don't ignore your emotions. I got to go to the Supreme Court. So here I am with some of you may or may not know. Her name is Chloe Cole. She's a detransitioner. So she had gender dysphoria. And so I was there. I wrote the piece for the Skrmetti versus the US, that medicine is discriminatory for a good reason. And it was about kids and the procedures that go on when they're minors, about the gender dysphoria and transgender. And we spoke at length, her and I, and she wished that she had something like ketamine early in her gender dysphoria. Whatever side you fall on that, when it comes to the kids, I don't think we're doing everything we can. And anyway, after talking to her and others, I wish more health people in the mental health space would consider things like ketamine or other psychedelics. I did a speak event. So this is called Speak Event Health. It's a break-off of TED Talks. Same George Andropoulos came from the TED organization, made his own event called Speak Event, and I did that. You can find that on YouTube. So it's basically this talk. I have been fortunate to do numerous podcasts, and if you can see this one, there's the IHMC podcast I did with Ken Ford and Don Krenagas, all on mental health, ketamine, and some chronic pain and other things. So I've been pretty blessed to be able to do those kinds of things. So I want to end. Let's come back to the question, is ketamine safe? Is it an anesthetic? Is it a healer? I hope you have more clarity on that now. But the big question is, would you use it? So if you were faced with suicide, your loved one was right in front of you and going down in a spiral, and you're not sure what to do, you've done everything, they're going to therapy, and I've seen this situation many times. I guess my question to you is, would you use it? Would you consider it? Would you consider it for yourself? And that's the main point of tonight. It's awareness. So this is a picture I took. I was the Dakar Rally doctor for 5 years. So I was in Bamako, Mali, and I saw this sunrise. And, I think there's a sunrise coming, and, we're seeing changes. And my hope is that we're going to see less young kids depressed. Hopefully less social media. I don't know, these things need to happen. Hopefully people, there's less deaths, let's just say. But I think there's a sunrise coming, and that's why I put this picture up. I accepted my truth, and this was kind of the adventure that you can see that my life has been, and I just want to wish you all the adventure of your life. And just want to thank my beautiful wife, Mylene, and my daughter, Charlotte, supporting me through all my escapades. I travel a lot, obviously. And I really want to thank this man, Dr. Ken Ford. None of this would be happening without Dr. Ford's help and support. And also Lori Zink, who, like I said, I've been here a while, and I was thrilled when they said, would you give the first lecture of 2025? Thank you.
Okay, we have some time for questions, and sorry, y'all, I can't throw the box tonight because we can't figure out how to work it. So I'll throw the mic. So I got some back. I see you, Alina. You were first. I see you. Okay.
So, great information, come from a mental health background.
Thank you.
I have done several lectures on suicide prevention.
Yep.
So, of course, we talk about pain, ketamine for pain, which is nice that it marries that way, and the significance of pain. However, you mentioned yourself that my statistics are a little different from yours, but about 50% of the people that commit suicide, you don't have an idea that they're going to.
I did say that.
Yes.
Yeah.
So was that
I'm
me or
sorry.
you?
That's
Okay, sorry.
Thing I think.
And mine are, 80 that 80% of the time you have some signs and symptoms,
Yeah.
etc.
Right. Right. Yeah.
Before it gets, because we're a lay audience predominantly, and we're talking about our friends, our neighbors, our family, people who we're not in the field where we are going to identify all the signs and symptoms.
Yeah.
Can ketamine be used for basically the clinical depression, major depression, the resistant depression, before it gets to the level, or even if we're not sure it's getting to the level of suicide?
Yep. Ketamine just got that designation to be used in all mental health diagnoses through the FDA, which is the nasal ketamine, and that just came out this week, actually.
Okay.
And but your point is well taken. Exactly. For the lay audience, seeing I'm not even going to say I'm an expert in it. And for sure, when it comes to kids, that's a whole nother ball of wax. And it takes a professional like yourself to really tease out what's going on. And that's why I'm saying don't ever hesitate to bring people to mental health providers, because that.
So if you
can
can't
be your
find a
savior.
mental health provider who will buy into the ketamine because it's off label,
Yep. You got to do it yourself. And you can do that.
would that be through a primary care physician? How would
Usually
you?
a psychiatrist
They
who's
will,
dealing
okay.
with esketamine will do it. I've trained many psychiatrists on how to use it, and they may charge a cash price. And usually a cash price in a clinic is like $300 to $500 a treatment, and you'll usually do a package deal, depending. If you can't, and it depends. It's hard to say which one is right, the intravenous way or the nasal esketamine way. The studies from Yale and such all point that the intravenous is the standard of care that really works. So, but anyway, it is possible to get ketamine, and you may have to go outside of your mental health provider who may or may not support it. But I can tell you more and more are doing so.
Careful.
Thank you for your lecture because it was very informative.
Yes, ma'am.
My
Thank you.
question is, what is your daily work, or where do you work that you had the opportunity to meet all those different clients that you gave us an example of? There was a wide range of ages, and I just want to know, what do you do what's your daily work?
Wow. Okay. So I've done 20 plus years of anesthesia, so I'm well set in that. And then, so I do about a week of anesthesia a month still. But I'll get these calls, and, I go to Vegas and I still work with the MMA guys. work with the motocross people. I still fly to many races. Sometimes I go to the UFC events, or often I'll just be going to their training places, and then helping basically manage their rehab, working with the orthopedic surgeon or something like that. Like I did physical medicine and rehab, so non-operative orthopedics are near and dear to me. But it's just, I don't know. I don't say no, I guess. I think that's the thing. And I just kind of follow what comes, and, that's the adventure of life, right? So I don't, I'm definitely not in it to, I don't know, become independently wealthy, and I don't make anything near I could. But you're right, the rich experiences I've had of traveling to, like the 5 years of going to Africa, that changes your life, and I love it, and I even went back to go do medicine back there for a month, and that was amazing, So, and then doing this PhD in France is something I've always dreamed of doing, and I'm trying to make that work out, and that's another continuation of my journey right now. So
Yeah, I've been taking ketamine for like a year now, like oral ketamine.
sure.
I'm getting a little worried about it because I don't know what about the side effects or whatever. I haven't seen a therapist, but years ago in 2017, I used to use a spray,
Mm-hmm.
and my psychiatrist just ordered it, and I got it at a compound pharmacy, and that caused all kinds of hallucinations and stuff. But it did stop.
Yeah, then the nasal. People are getting away from the nasal stuff.
Yeah.
Because it increases the blood levels so high so fast, it kind of negates the effect. And remember what I said, it's not just about the medication, it's being in the right place at the right time with the right tools and the right therapist, again, whoever that is for you. It's got to be somebody, right? And all that is how ketamine becomes a healer.
Well, the
Yeah.
stuff that I take that's through mail order, I'm supposed to take it every day, and it's like 100 milligrams.
Right. And I get that. I see that a lot.
But I don't know if that's the right
not-
way to go, or whether I should go to get the infusion or not. I
Well,
don't know.
the gold standard studies are with the infusion, depending what you're dealing with.
Okay.
And again, that's going to be with your mental health provider, who can help you distinguish and guide you down the right road. And somebody preferably who's knows a bit about it. So that's what I would say. As far as long-term oral administration of ketamine, that's a very low dose, especially compared to street ketamine, right? And it's very well tolerated, at least in the studies I've read. So I wouldn't fear so much about that. I would just encourage you to, it takes work.
Yeah.
It doesn't just come. You got to put the work in with it to get the rewards. That's what I would say.
Okay, can y'all, I've got everybody, and I see all y'all, but I had some people who had their hands up here for a while earlier. Sir?
Thank you for that informative presentation tonight. I've read, and I'm sure many people here have read, that mental health professionals are now using psychedelics, particularly psychedelic mushrooms, to treat mental health issues like depression.
Yep.
Are there good clinical studies to show that is effective? Is it effective as ketamine? What are the pluses
Well,
and minuses?
most of the studies are on ketamine, but there are many more studies now coming out on psilocybin. There's 2 states, Oregon and Colorado, I believe, that have legalized psilocybin, the mushrooms. And again, it's not as straightforward as ketamine. Most of the studies are done on ketamine, and I guess I'll repeat this. The ketamine is technically the only drug that we have that's available, legal, that can be given in a clinic, you come in that day, you could get it, versus going through the hoops of getting other psychedelics. Now, to go further on that, many people, they'll go to Peru or whatever like that and do the ayahuasca, and they describe some of the same things. They were enlightened, their depression lifted, they saw the purpose of their life, the things like this. I'm not saying it's for everybody. And actually, I want to say there's people it's absolutely not for too. I'd never, and I'm careful about that. But anyway, to answer your question, yes, there is much more research coming out on psychedelics. Also, MDMA is a big one right now. If you look in the UK, there's a lot of studies on psilocybin right now in depression, PTSD, autism. I mean, bulimia, other mental disorders. So, just keep on PubMed. You'll see them.
Thank you. Generally, with a new medication, there's a Burroughs Wellcome or Eli Lilly behind it, or a lobbying group. Is there anything besides the Ketamine Advocacy Network? We have a family member, we're very concerned about. The facts are there. With the new administration, some of us will do our own lobbying, but is there anything you know about that can bring this forward? Because that's the tribulation I think we have.
Okay, so that's I have some relations with RFK, and RFK is for using psychedelics for mental health. Doesn't mean he's going to get it passed. He's not the only one, though. I'm working with Tony Lyons, the owner of Skyhorse right now, and we have about 30 representatives and senators who all have expressed interest in this space of using psychedelics for mental health and helping things like depression and suicide rates. And so the interest is out there, even from a political standpoint. And I think that's further than we were 10 years ago.
Dr. Edwards, thank you so much for your excellent presentation. It's given me some insights that I wasn't aware of, and I'm very, very grateful, very thankful. I wanted to ask you, with this particular drug taken by people, is it like a forever? Is there an end point where they don't take it any longer, or did they take once they start?
Absolutely. I mean, usually a couple treatments and 2 to 3 treatments, something 3 to 6 or something like that, and most people don't need it anymore.
Oh,
but again, that's working with a therapist, doing the therapy, doing the work.
okay.
And once, and then, but you always have it if you need it.
Okay.
And I mean, I've seen multiple people just use it like 3 to 6 times and then never use it again.
Excellent.
And then, but I don't know, it's kind of nice knowing that it's something like that's there.
Okay, so thank you so much.
You're welcome.
All right, y'all, I know everybody has a million questions. So I've been holding, I've got two more back there, and Jose, and that's what afterwards, we'll have to cut that off.
Regarding psilocybin, there's some big national ongoing studies that should be out this year. So the data is going to be very interesting. So we need to keep an eye on that.
Yeah.
Thanks for your presentation. I had a follow-up question to the last question, which was about the dosing schedule. How is it decided how long to keep and how long to maintain the dose? That was one question. And the other one is, what does the American Psychiatric Association position is regarding the use of ketamine for refractory depression?
Great question. Well, now that the FDA has approved Spravato, the American Psychiatric Association has adopted that, I can tell you. But honestly, I haven't seen that much from the APA regarding, say, the use of psychedelics. I think they're pretty neutral to quiet about it. I mean, overall. You're going to hear more things like from the American Suicide Association. And things. But, that's, I have to be honest, that's a question I'm not that familiar with. I mean, I work with plenty of psychiatrists, so I know it's out, the interest is there. To your question about dosing, usually the Yale, Dr. Crystal and Bergman and those people who kind of discovered the proper administration of ketamine for mental illnesses start about 0.5 milligram per kilogram over about 45 minutes. So that's the proper, it's a really low dose. And I mean, it's not something that's going to like put you, in outer space, so to speak. It's not meant to do that. And if you stay within those parameters, things go well, So I guess, dosing and then, longevity, how long do you have to dose it for? I think that's an individual question that's always going to come up between, the person giving the ketamine and the working with the mental health provider, psychiatrist, psychologist, that kind of thing. And I think that's, that's very important. So.
Okay. Dr. Edwards, thank you so much for your talk too. I'm a physical therapist. I've been in here for about the past 14 years in Ocala. Worked with some combat veterans that have had some experience with the IV ketamine.
Yep.
But I was just curious, could you explain why it works? Like I've listened to some podcasts about, make sure they get REM sleep. It disassociates the trauma from the experience. And do you feel like that's really the mechanism of why the ketamine's so effective?
I would say, again, you can't come out of a ketamine experience without a change in hope. That's one big thing. I mean, in almost any psychedelic, when you hear people on ayahuasca, whatever it is, it's always part of that. The other thing is you can imagine ketamine doing, imagine if you have a fear of needles, or I don't know, that PTSD that triggers you. And now in that experience, you're able to come face to face with that trauma that you weren't able to before. And now you can come face to face with it and not get triggered and know you're okay and be okay. Not many things do that. And that's what I would say in PTSD and veterans, like I write about in the book, they have PTSD about their guns melting as they're trying to protect, shoot the enemy or protect their friends and things like that. And then during the experiences, they have the angel, the soul, whatever, somebody in white usually. That's what I write in my book. Come on there and, hey man, it's okay.
So, Johnathan, thank you again. Let's thank Johnathan again.
Thank you so much.